Now, new COVID-19 variants are sweeping across the world, and epidemiologists say the Pacific needs to be on alert. While case numbers are now relatively low across most of the region, they're rising fast in Tuvalu, one of the last countries in the world to experience an outbreak. Professor Fiona Russell is a leading epidemiologist and vaccine researcher with the Murdoch Children's Research Institute. She says there's a high risk of new variants spreading to islands that may or may not have been exposed before, so it's vital countries are up to date with vaccinations.
Tuvalu, for example, has got COVID for the first time. They have got very high vaccination coverage, thankfully, and so if they're elderly and high-risk people are well covered, then that's sort of the best way to meet the virus, with this sort of inevitable sort of situation with the open borders and cruise ships and international travel, etc. However, many countries around the world have seen that with these Omicron subvariants that are coming now, that the disease is less severe. However, that's because these countries have had lots of waves of different variants of Omicron and prior variants of the virus. People have been vaccinated at a high level as well. So that means that the population has been, at a population level, has been protected by what's called hybrid immunity, which is a combination of protection from vaccination and the immunity that you get from a previous infection. However, many of the countries in the Pacific have had little exposure, thankfully, to this virus. And so they're heavily reliant or solely reliant, for example, such as Tuvalu, on vaccine-derived immunity. And so how the virus plays out in some of these countries, and particularly on outer islands where there may not be access to good health care or, any health care really, this is sort of very concerning. So I would really strongly encourage for anyone living in the Pacific who's not up to date with their vaccinations to go and get vaccinated and make sure they're up to date.
And in terms of these new variants, as you've just mentioned, they are new. Can you tell us a bit how they differ from the other variants that we've seen before?
Yes, they all come from the latest variant, which is Omicron, which began late last year. So they're all derivatives of that one variant of concern. And so the latest ones are more immune evasive, meaning that you can still get an infection. So, infections are still common and they're extremely highly transmissible. So they sort of whip through the population very quickly. And very hard to control with the usual sorts of measures that we've tried to help control it.
What other measures can people adopt?
Yes, so, certainly staying home if you're sick. So if you've got any symptoms, whether yourself or your children have got symptoms, to stay home until the symptoms go away or for 5 days until the symptoms resolve. That's a really critical thing to do. So it may be that you don't have COVID or it could be some other viral illness, but still is something that can be spread around the community. Also, if you're indoors in a crowded place where the ventilation is very poor, masking up is also important, particularly for those people who are elderly and those that are higher risk of getting severe disease as well. And wearing a good quality mask if possible.
Some timely advice no matter where you are in the world. That is Professor Fiona Russell from the Murdoch Children's Research Institute in Melbourne talking to Dubravka Voloda.